Have you ever wondered how prevalent post-traumatic stress disorder or PTSD is among military personnel? It's a significant concern, and for good reason. Military personnel face unique challenges and experiences in their roles that can often lead to PTSD. While anyone who has experienced trauma can suffer from PTSD, the nature of military service places personnel at a particularly high risk. Imagine being exposed to high-stress and traumatic situations regularly. This is the reality for many military personnel who experience combat, witness violence, and survive life-threatening events. Deployment, especially to combat zones, can expose service members to prolonged periods of stress and trauma. The constant threat of danger and exposure to traumatic incidents contribute to the risk of developing PTSD. Combat exposure is a significant risk factor for PTSD. The intensity of combat situations, exposure to casualties, and the emotional toll of combat operations can all contribute to the development of PTSD symptoms. Estimates suggest that up to 20% of military personnel who have experienced combat may develop PTSD. Interestingly, PTSD symptoms may not manifest immediately after a traumatic event. Some service members may experience a delayed onset of symptoms, complicating diagnosis and treatment. Once present, PTSD can significantly impact a service member's ability to carry out their duties effectively, affecting their mental well-being, relationships, job performance, and overall quality of life. Despite increased awareness, stigma still exists around mental health issues in the military. Fear of career implications, perceived weakness, and concerns about judgment can prevent military personnel from seeking help. So, how can we address the prevalence of PTSD among military personnel? It requires a comprehensive approach that includes awareness and education about PTSD, its symptoms, and available resources. Implementing regular mental health screenings and assessments can help identify individuals at risk. Ensuring military personnel have access to effective and timely mental health care is crucial. Establishing peer support networks and providing resources for transitioning service members to civilian life can also make a difference. In summary, the prevalence of PTSD among military personnel is a major concern, made even more significant by the unique challenges and experiences they face. With a comprehensive approach encompassing education, screening, access to care, peer support, and transition support, we can help our military personnel manage and overcome PTSD. It's a battle worth fighting for every single one of them.